I'm Dr. Matthew Harb. I'm an orthopedic surgeon. I do mostly hip and knee replacements. I work in Washington, D.C. and Maryland area. And just jumping on, if you guys have any questions, toss them in the chat. I'll go ahead and answer them. And I deal with a lot of musculoskeletal injuries. I do a lot of hip and knee replacement surgery. A lot of people I treat with arthritis. And then I do some orthopedic trauma call, meaning people who get brought into the hospital by an ambulance, sometimes by a helicopter, at what's called a level 2 trauma center. So I'm actually just finishing up my call for the week. So I've been on call for the last week. And a couple emergencies have come in, but nothing too crazy. How did I decide which med schools to apply to? So the good thing for me about applying to med school was that it was actually not that difficult because I was in Louisiana at the time. So there's really 3 main med schools in Louisiana. There's LSU New Orleans, LSU Shreveport, and then Tulane. And so for me, it was about in-state tuition, meaning I didn't want to be, $400,000 or $500,000 in debt going to med school. So that's why I chose. That's why I chose that reason. Anyone who's lived in the South knows what Southern hospitality is. You went to UVA, dream school? Yeah, University of Virginia, great place. I love it. Very good training there. So the good thing about, let me try and fix this. The good thing about, hey, what's up from Italy? Nice. The good thing about University of Virginia is that it has this huge catchment area. It's a level 1 trauma center, meaning that a bunch of people come in from all over. You're my favorite doctor on here. Thank you. I try to make entertaining videos. Education can be delivered in a couple different ways. I like the fun videos. I think I can get like 1 or 2 teaching points out. It's a different style of teaching than, just lecture or boring stuff. So I really like the videos in the background. Southern hospitality is a real thing. Yes, you are correct. I have no cartilage left, and they say it's a hip replacement. Is there anything else? For cartilage that's gone, if it's bone on bone, that's really all there is for the hip. Hey, what's up? Welcome to the live stream. If you guys have questions, drop them in the chat. I can see them both. I can see them on YouTube and TikTok. I just got my YouTube Creator Award, so thank you for anyone who supports me or follows me on YouTube. Thanks for the roses. I appreciate it. What do I think of stem cell therapy? It's very expensive. It can cost a lot of money, and there's not good literature to support it. If you have a lot of money and you really don't want a surgery, you could try it. Hey, what's up? How are you doing today? I'm doing great. Why do we have random itches out of nowhere? Well, everyone's a little bit different. Usually when you itch, it's because your body actually releases something called histamine. And you can have different reactions, and you also have little nerve endings in your skin, and those can all make you itch. I'm 57, I have both knees replaced. Is the treadmill acceptable? I let my patients do the treadmill. I'm doing great. It's been a good weekend. I have a busy week coming up next week. I have a lot of operations to do. Your son's a pathologist at University of Alabama, it sounds like. Great. That's a I went to LSU, so there's a little bit of a college rivalry there, but that's a good place to be. Going for my second hip replacement because I got AVN. Is it likely I'll get it in the other joints? I would say the hip is the most common area for AVN. AVN is when the bone actually dies because it loses the blood supply. And so if the bone loses the blood supply, it can be due to a couple different things. It can be due to medications. It can be due to being on like cortisone or chemotherapeutic agents or autoimmune agents. And so if you're still on those agents, meaning the cause of the dead bone doesn't change, then you could get them in the other joints, or you have an autoimmune disease. What's a good way to reduce heartbeats per minute under anxiety and stress? A good way is just taking 2-3 minutes. Try and find some meditation exercises. There's some really good mindful exercises that you can do, but sometimes it's just taking a seat back, closing your eyes, taking a couple deep breaths, trying to calm yourself down. The other thing that leads to a lot of anxiety is we all are drinking a lot of caffeine these days, whether it's in energy drinks, pre-workout supplements, coffee. If you minimize the amount of caffeine you drink and increase the amount of water intake, then you will also have less anxiety, and you'll probably maybe even sleep a little bit better. If it's really bad, some people will do like actually take a medication called a beta blocker, which actually slows their heart rate, but that's like severe anxiety. Little bumps or redness on the arms, it could be eczema. Very common in little children. I'm 58, I have OA, and I have four titanium joints. Congratulations. Hopefully they're all holding up and working well. I was going to do something. I wanted to do like a little poll. Let me see if I can do that. I know there's a way I can do a poll on, interact here. Let's try a poll. Okay. So I'm going to put a poll up. If you've had surgery before, do a smiley face. If you haven't had surgery before, do a sad face. And we'll see how many people in the chat have had surgery before. Wow, a lot of people have been operated on. That's a lot. I wouldn't expect that many people to have surgery. Maybe just everyone who follows me. Maybe it's the whole test is biased. And do I do knee surgery? Yes, I mostly do hip and knee replacement operations. It's interesting because everyone's name has changed. TikTok actually just made it so that it's no longer your username in the chat, but now it's your actual top name. So, names I may have recognized from before have completely changed. I'm a pre-med student. I'm applying for med school next year. Good luck. I wish you the best of luck. Any advice for someone applying into orthopedics? Find a good mentor. Do some research. Wow, 40 people in the chat have had surgery and 9 have not. Those numbers are a little skewed. It's probably just that it's my channel and people follow me if they've had surgery. Wife needs spinal surgery. Sorry to hear that. Sometimes there's injections and things you can do. I have a lot of back pain due to herniated discs. What can be done about the back pain? If you have herniated discs, a lot of the time we're doing physical therapy. We're doing anti-inflammatory, some ice therapy. In really bad cases, if it's pushing on a nerve, we'll do a cortisone injection into the back. Thanks for the follows. Thanks for all the double taps, likes. I appreciate it. Congrats on 100K subs. Yeah, I got this. So I did a little unboxing video. I didn't put it up on TikTok though, but I've been making educational content for the last 2 years, but I hadn't done very much on YouTube, and so I just kind of picked it up in April, and I already we hit 100,000, and we're growing. I think we're at almost 130,000 now. So this social media journey has been good, and people enjoy it. Where am I located? I'm located in Washington, D.C. in Maryland. I do mostly hip and knee replacements. Am I friends with Dr. Mike? No, I've never met Dr. Mike before. I know he's popular, and he's been around on these platforms a lot longer than I have. But I think his message is good. He kind of does the same thing, which is, online educational treatment, which is great. Is it too early to start an ortho residency at 34? No, I wouldn't say so. The average age for going into residency is around 26, 27. A lot of people are taking a year off, so it's not too old at 34 for sure. We need to get you verified. Yeah, that may be a tough one. I don't think I'm popular enough to get verified yet. Maybe one day. I would love to have a blue check. There were some people impersonating me at one point, and I reached out to TikTok, but I never heard back from them. Have you heard of epithelioid sarcoma? Yes, I have. There's a lot of different skin cancers. Usually if it's a sarcoma, we're usually removing it. All right, let's try another poll. Let's say, have you ever been in a cast before? If you've been in a cast, put a smiley face. If you haven't been in a cast, put a sad face. I've had 6 shoulder surgeries. Can they still fix it? Surgery on Wednesday. It depends what they're doing shoulder surgery for. Okay, that's a little bit better. Less people in a cast. Happy face if you've been in a cast. Sad face if you've never been in a cast. Decore veins, tenosynovitis. So decore veins, you have a bunch of different parts of your hand. Decore veins is when this tendon gets very inflamed. The most common time we see decore veins is when new people who have new babies, mothers who are holding their babies a lot. We see it in people who get new pets. I've seen it in people who cook, who are like trying to package stuff for charity, just using the hand a lot, basically. And so we'll do anti-inflammatories. We'll do it's called a thumb spica splint, which there's a link to a thumb spica splint in my bio. You go to my Amazon store, and in the worst case, we'll do an injection. We're not really doing surgery for it, but it would be an option. But yes, I do a lot of my surgeries outpatient. I do a lot of hip and knee replacement outpatient and same day surgeries. Do I perform hip hemiarthroplasties, so partial hip replacements? Yes, I do. Most of the time I'm doing a total though. A hip hemiarthroplasty can have its own issues. So most of the time for like a broken hip, I'll do a total hip replacement. What can I take for osteoporosis? I have a lot of my patients on vitamin D and calcium. It depends on your osteoporosis level, and you can do 2,000-3,000 IUs of vitamin D a day. You can do 1,200 milligrams of calcium. You can make sure you exercise, get a good workout, and anytime you put weight through your bones, then you make the bones stronger. That's called Wolff's Law. And so those are all things you can do. You can get a DEXA scan. DEXA scan actually tests your bone density level. If you've fallen or you've had a fracture before, then we'll put you on some medication. Thank you for all the follows. I appreciate it. Can you have a gastric bypass when you're paraplegic? There could be some issues. It depends how your nerves work and what level you're paraplegic at. And, so it would be a question to, they would probably have to get a neurologic workup on you, and then also check like your gastric motility probably as well. And so, I'm not a bariatric surgeon, so I don't have the answer to that question. I would probably consult with a bariatric surgeon. What can you do for bone on bone in the knee? So that's what I mostly treat. I treat a lot of arthritis, a lot of bone on bone, and I do replacements. Did an MCL reconstruction a year ago and still feel pain. Any suggestions? The question is, do you have pain or do you have instability? If it's pain, you could look at the meniscus and the cartilage, see if that's okay. If it's pain over the MCL can take a while to heal. MCL is it's a strong ligament in the knee. It takes a lot of the force when we do things on a day-to-day basis. All right, let's see what else we can do. All right, smiley face. What's lightning Q&A? I don't know what that is. Let me try this. Randomly select a question. I don't even know what light. Oh. Can you guys see that? Can you guys see this topic at the bottom? I've never tried that before. Let's see. All right. Let's do another poll. Start a new poll. So this will be a poll. Have you ever had a joint replacement done? Let's see how many people in here. Smiley face, yes. Sad face, no. How long is an orthopedic residency? Orthopedic residency is 5 years, and then you do a specialization. And you can specialize in a couple different things. You can specialize in orthopedic oncology, which is tumor surgery. You can specialize in pediatric orthopedic surgery, spine surgery, upper extremity, sports, shoulder, elbow, hand, foot and ankle, and then what I do, which is joint replacement surgery. Sir, how to become a good orthopedic, like someone who knows his practice and his skill really well? I would say that the training to become an orthopedic surgeon in the United States is very rigorous. So it's very rare that you get like a completely incompetent surgeon who made it through all of that. It's about repetition. It's about doing a lot of cases. It's about being good at your craft. And so, orthopedics is a lot of hands-on work. We're replacing an entire joint. So it's mechanical. It's like engineering. So if you're good with your hands, and you can be a really good orthopedic surgeon. What do you do if you don't get into fellowship? You could be an orthopedic generalist. The generalists it's harder to get jobs in cities because it's so competitive. They really want specialists in the cities. But you could go out into a rural area and become a generalist. Be nice to your circulators. Thank you. I will. I try to be as nice as I can to the staff I work with because they control everything. They control room turnover. They control how quickly my case goes, or if the good circulator or good staff wants to work with me. What's my favorite surgery to do? I love doing hip and knee replacements. It's what my specialty is. I do some orthopedic trauma too, but really direct anterior hip replacements, knee replacements, they're fun. Why hasn't my hip healed a year after surgery? I don't have a good answer to that. I would get some x-rays, maybe get a good exam, maybe follow up with your surgeon. Yeah, I mean, so technology in orthopedics and surgery is, when will it get so good where, the surgeon isn't needed anymore? I don't think we're close to that yet. It may be another 50, 100 years off before, robots are actually pretty good at doing surgery. I'm a pre-med student. What are some good tips on applying to med school? Apply broadly. It's very competitive. Get good recommendations, find some good mentors, get volunteer hours, try and get some research if you can. Ortho bro, hey, what's up? I love orthopedics, so I couldn't imagine being in a different specialty. It's enjoyable. The work-life balance is good. Patients get better. So that's let's see. How does your staff? No, I mean I have great teams. I have a great team who I work with. I have a physician assistant. I have a really good rep. I have a circulator and staff at my surgery center. I all hand pick them. So everyone's good, and if you have good staff, it makes the patient outcomes better. So if you didn't choose ortho, what would you choose as your second choice? I thought about plastic surgery for a second, but that didn't last very long. Hip and knee replacement common. I really liked the show on TV. And I thought plastic surgery was the way to go, but that quickly faded away. Hip and knee replacements common, easier recovery compared to ankle surgery. Why? It depends what's happening with the ankle surgery. If it's, the recovery from a hip and knee replacement is very predictable. And so that's why it can be a good outcome, because we know what's going to happen. We know the course of recovery. Do you have orthopedic technicians who put casts on, or do you do them yourselves? So we have occupational therapists who, if we need a specific cast, they'll create these pre-molded casts. So leg length discrepancies. Leg length discrepancies are something many people, about 20% of the population, has leg length discrepancies. When we're doing a hip replacement, the first thing is stability, but sometimes we'll try and correct the leg length discrepancy. I use intraoperative X-ray, which is fluoroscopy, and I use a machine called the RadLink sometimes to line up the leg lengths and make them even. Hi, doctor. Once again, why do my knees burn? Is that an indication of arthritis getting worse? It's hard to say where the burning is, if it's on the inside, the outside, over the front of the kneecap. The easiest way to rule out arthritis is to get an x-ray. What is the metal you replace the joint with? It's partially cobalt chrome, partially titanium. Let's see. I think I got it. All right, so here's a joint replacement. Depends on what knee. Now, there's a couple different materials, but usually this part's cobalt chrome. This part is polyethylene, which fluoro and C-arm are the same. So the C-arm is fluoroscopy, basically. The polyethylene in the middle, and then the base plate, which is usually made out of titanium. 15-year-old living with a dislocated hip for 12 years. Ortho in Ireland won't go near her. It depends. Is she ambulatory, meaning can she walk? If she can walk, that's called developmental dysplasia of the hip. It has a classification associated with it. If it's all the way dislocated, it's called what's called a Crow 4 hip. Surgeons in the U.S. would do an operation for it, probably. Physical therapy is very helpful. Having a total knee replacement tomorrow. I wish you the best of luck. There's really good guides on my website for hip and knee replacement guides. Favorite soccer team? Do you have a favorite? I played a lot of soccer growing up. I was even on like some club teams in like high school, and I did like some recreational leagues in college. But now I'm so busy. I don't for sports. I'm really just watching college football, so I'm not really watching too much soccer. I need a replacement femur bone. That's a really big surgery. We're usually doing that surgery for like tumors or multiple failed surgeries. There are some total femur replacements. There's a system called the GMRS. It's by Stryker. What medical school did I go to? I went to LSU. Yep. The good thing about LSU, it was in-state tuition for me. It was very cheap. I could have gone out of state, but going out of state means you're paying crazy amount of dollars. So my overall medical debt when I was done was not that high because my medical school wasn't that expensive since it was in state. And I still went to, a good residency program. I went to a really good fellowship program. And, my tuition at the start of it, like some of the people who I went to residency with went to like NYU and things like that, where they were paying like $80,000-$90,000 a year tuition. And, they end up graduating with like $400,000 or $500,000 debt. Well, you don't need a beta program for a total femur replacement. There are total femur replacements. Depending on where you live, if you're in the United States, I would find one of the major universities in the area with a revision specialist or an orthopedic oncologist, and they could do a total femur on you if you really need it. Hey, how's it going? Thank you for giving us all support and answers on our questions. My orthopedic doctor barely talks to me and answers my questions. I feel like that's a common issue. The problem is with healthcare now is that reimbursement has gone down so much that in order for physicians to keep a practice open, we have to see a certain number of patients. If we don't do that, then we can't pay the staff. And if we can't pay the staff, then we basically go bankrupt. So, because reimbursement is down, we have to see more patients. There's not enough time. And, I wish I could spend 15, 30 minutes, with every patient I see. But if I spend 30 minutes an hour with every patient, then I may not, I won't be able to see 40 or 45 patients in the day. So that's one of the big issues in healthcare is that doctors are getting stretched very thin because they're just required to see more patients and there's not enough physicians in general. So, one of the things that I think is great about social media is it opens up this opportunity to, provide a little bit more education, a little bit more direct contact that maybe didn't exist before. How do I feel about podiatrists? Podiatrists, there's competition between the orthopedic foot and ankle market and podiatrists. Some podiatrists can be really competent. I would say that the orthopedic foot and ankle training is a longer road than podiatry. I believe podiatry is only 3 years, whereas if you're going to be an orthopedic foot and ankle specialist, you'll do 5 years orthopedics and then 1 year foot and ankle specialist, so you get 6 years total. So there's a little bit more training there. But podiatrists can do all the same stuff, most of the same stuff that orthopedic foot and ankle can do. Do you avoid surgery on people with connective tissue disorders? No, I do have some patients who are EDS patients who need replacements. I would say EDS is probably the most common hypermobility disorder that causes labrum tears or really bad hip arthritis. And so I have done hip replacements before or knee replacements for EDS patients who have developed arthritis. Now, if you have connective tissue disorder, then your risks for complications are much higher. They go up. Thank you for what is that? A finger heart. I appreciate it. How can you tell if it's arthritis in your knee as opposed to a torn ligament? We get an X-ray. X-ray is a diagnostic tool for arthritis. A damaged radial nerve due to fixation in the humeral shaft. Any solution? I'm 27. I'm sorry to hear that, Green Lantern. The humerus, the nerve runs right on the humerus. So the question is, was the nerve cut? Or was the nerve just stretched? If the nerve was just stretched, it could take a year and a half to come back. You'll notice because you'll start to get some wrist motion back. If it doesn't come back after a year, you could do what's called an EMG, which is a nerve conduction study. They do have some procedures where they can do nerve grafting procedures. And then the other solution is a tendon transfer procedure. So there are options if you do have a radial nerve injury. Patient in Ireland living with crutches, severe pain, 5-year-old, post SDR. I'm not sure what SDR is in St. Louis. Is that some type of osteotomy? Sorry to hear that. It's unfortunate. I had both knees replaced last year. Oh man, these are flying. All right. How do you feel about Brian Kelly at LSU? All right, that's a better one to answer. I don't know. It feels like it's been years. You know, there's so much drama with Ogeron, and you know, Brian Kelly coming over from Notre Dame. Hopefully everything works out well. I think we're all interested to see. You know, our team the last year and after Joe Burrow just hasn't been very good. So I think we're all excited. You know, the big thing is that Brian Kelly has never, really won a national championship with Notre Dame. So hopefully he does better at LSU. How do you handle the stress of being a surgeon? Once you know how to do everything, it's not really that stressful. Yes, I cut people open. I'm inside people for a living, but it's if you know what you're doing, it's not that stressful. The stressful part is having people recover. The actual surgery part, that's not that bad. The hard part is, everyone recovers different. Who's going to have pain after the operation? Who's going to get up and walk right away? Who's going to take a little bit longer? That's kind of the stressful part of being the surgeon. It's not so much the surgery itself. Total replacement with knee robotics. How long is the normal lifespan? And what do you think? It sounds like of Zimmer. Total knee replacement lifespan, about 60% are still intact at 30 years after the operation, so very good longevity. This, if you look at the knee, this plastic piece in the middle has become very, very durable, so it's not wearing out as much. And so we're not having to replace them because those are wearing out. Now, infection's a risk, coming loose is a risk, fracture's always a risk. What do you think about bone-on-bone in the spine on 2 levels? Is surgery the best alternative? A lot of the times the spine can actually auto-fuse. If you have a pinched nerve, meaning you have shooting pain down your leg, like sciatica, then it may be helpful. You could try cortisone injection in the back. If that doesn't work, then surgery. But I usually try and say avoid back surgery if you can. Intersection syndrome, just had a steroid injection. Intersection syndrome is a very rare diagnosis. I haven't seen a lot of people with it. A steroid injection can help. People that I have seen with intersection syndrome, they tend to have a very difficult time with it. The recovery can be long without surgery, can take 6 months to a year to recover. Injection can help calm down. I have seen some people who haven't recovered from it completely and had to go for a surgical debridement, basically getting rid of all the inflammatory tissue. So it's a very difficult condition to live with if that's what you truly have. What's the top question I should ask my surgeon before my total knee replacement? So if you're going for a total knee replacement, I would recommend reading my total knee replacement guide. It's on my website. Just go to matthewharbmd.com/links, go to my personal website, and you can go to patient resources, and I have a whole guide on how to prepare for total knee replacement. And those are patients' most commonly asked questions. I would read through that, and then you'll probably have some questions from that you can circle. Love your content. I work in sterile processing at the local hospital. Oh, thank you for these awesome balloons. I work in sterile processing. You guys don't get enough credit for your job. You guys work really hard to the bone, and I think it's probably sterile processing is the most underappreciated job. So thank you so much for everything that you guys do. You guys make our job easier. Double below the knee amputation. Thoughts on phantom limb pain? Definitely can have that from amputations. There is some mirror therapy. You can look it up. It's very good for phantom limb pain, and sometimes some therapists can do that. I work for a surgical company called Invasive. I'm familiar with Invasive. We make a lot of spine stuff. I think they make the magnetic nail. Isn't magnetic nail is Invasive as well? Haven't used them in a while. I used them when I did pediatric and spine surgery when I was in my residency, but big company. Thank you for recognizing us in sterile processing. Looks like we got one on YouTube too. Thank you, Sharon, for everything you do. The Green Lantern, your radial nerve was stretched, so if it hasn't been 6 months to a year, you're probably waiting at least 6 months to get a nerve conduction study to test the speed. You'll probably know by about a year if it comes back or not. What do you think about stem cell therapy? It's very expensive. I'm not usually recommending it for my patients. You draw the stem cells out of the pelvis bone, which can be pretty painful, and then you spin them down and inject them, and there's not good literature to say it's better than like a cortisone injection. I had both knees replaced last year, and it's the best thing I did. Thank you, Marilyn. Oh, this is good. I can see everyone's name, so I can actually directly respond. Let's see. Okay, Kathy says, when I wake up, my left thigh is about 6 inches long, 4 inches across, and terrible pain. Sounds like there's a nerve. There's usually a nerve over that front of your thigh. It's called the lateral femoral cutaneous nerve in that area, right over your front pocket. That may be irritated. Some people who wear pants too tight or who've had it irritated by a surgery can get those issues. Is there truly a difference in matching DO versus MD? Yes, DO school is easier to get into. You don't need as high of grades, GPA, score. Now, when it comes time to match into a residency program, it's a little bit tougher for DOs to get competitive specialties versus the MD. At the end of the day, on paper, it's the same, right? We have the same prescribing privileges. We can both be board certified. But just from a competitive aspect, it is a little bit easier to get into DO programs. Have you ever denied a surgery? Yes, I have denied a surgery. I'd say the most common reason I deny a surgery is that a patient is their diabetes is too out of control, meaning we measure their diabetes level. If the diabetes level is way too high, I say get it down. So most of the time I'm canceling for things called modifiable risk factors, meaning you can get your health better to make your outcome better. And the first thing you can do is get that A1C, that diabetic control in control. The next thing is getting the weight down, trying to get to a BMI 40. Now, I've operated on people BMI higher than 40. I think I did a BMI 47 the other day, but that's not the norm. The goal is to decrease the weight to get that down to decrease infection. Where are you? I'm in Washington, D.C. in Maryland. How long will it take for a total knee replacement to be finished? It takes me about an hour to do my total knee replacement operation, start to finish. And then for me, I do a lot of same-day knee replacements, meaning get you up walking 30 minutes after the operation and you go home that same day. I had both knees replaced last year. One is causing issues, patella instability. I'm sorry to hear that. If you have patella instability, you may need a ligament reconstruction. In the worst case scenario, you could get a CT scan and check your component alignment. If one of the components is rotated a little bit too much or too little, that could cause a kneecap to be unstable. What would make a knee hurt when it bent backwards? You're just pulling on all that tissue. Depends if you've had a replacement or not, but all the ligaments and everything get stretched. Thank you for all the double taps, all the likes, shares. Appreciate it. Let's see. Wow, I didn't know diabetes had such an impact on surgery outcomes. Thank you for sharing that. Yeah, so diabetes has a massive impact on surgery outcomes. Now, there's different levels of diabetic control. We measure that through a value called the hemoglobin A1C. And the hemoglobin A1C, we know if it's less than 7.5, the risk for infection is much lower. Above 7.5, you get a higher risk for infection, poor wound healing. You can get peripheral neuropathy. It can give you cataract. So diabetes and poor sugar control can create a lot of problems. It's the most common reason in the United States for amputations is diabetes. Thank you for the follows. Do I take a lot of trauma calls? So I'm actually on call right now. I mean, I technically could be called into the hospital if an emergency came in. I've been on call for the last week. I haven't had too many emergencies to go in for, but I probably take 1-2 weeks of trauma call every 6 months or so. Yeah, diabetics do have trouble healing. How long do nerve blocks last in knee replacements? It depends if you use a special medication with the nerve block. There's a medication called Exparel that you can put in with the nerve block, and it actually makes it last about 1 to 3 days. Everyone metabolizes the anesthetic agent differently. But I use that for my nerve blocks for my total knee replacements. Hip replacements 5 weeks ago. Can I sit in a beach chair? It depends what kind of approach you had. If you had an anterior approach or a posterior approach. If you're on posterior hip precautions, then it may be something to avoid. For my anterior hip patients, I'm not putting a lot of hip precautions on. My husband has a bone that always hurt right above his ankle bone. Why is that, and what do you do? It sounds like his tibia is right above the ankle. Hard to say. Sometimes we probably get an x-ray, maybe get an MRI. Yeah, anterior approach. So it depends if your surgeon puts you on hip precautions or not. So I would check with your surgeon for hip precautions. Does a steroid injection for nerve pain work right away? It depends where it is. If it's in the back or somewhere else. Is the pronator quadratus always cut when a broken wrist is plated? Usually, yes. The pronator quadratus is it's released off the edge of the bone, and then it's most of the time either reattached. But there's actually some studies showing that there's no decrease in strength if you cut the pronator quadratus. If you cut that muscle, it will just scar back in. Do you do surgery with someone with factor V Leiden? I would, but I would probably keep them on a really strong anticoagulant after. So that would be a risk that we would discuss with hematology, with their hematologist. Where do you hurt if you need a hip replacement? Okay, that's a great question. So if you need a hip replacement, the way you feel your groin and your hip socket, that's in the front, in the groin. When you feel pain on the side of your hip, that's called bursitis. When you feel pain in the back of your hip, that's called sciatica, or you have lumbar issues, lower back issues. So where you feel arthritis and where you feel hip pain is in the groin. I just had hip replacement surgery. Hope you're recovering well. Do lumbar fusions still lead to issues due to hypermobility? Yes, they can. So if you have a lumbar fusion, the level above and below can actually be exacerbated. Thank you for the follow. I appreciate it. So you can get what's called adjacent level disease, and that's something that can happen if you have lumbar issues. But I appreciate all the questions. These live sessions, I think we get a lot of questions answered. If you have a question that I didn't get to, I can always drop it. Just drop it in my Discord channel. There's a link in my bio, and I can always answer those when I'm off. But I hope everyone has a great start to their week, and thanks for jumping on, and thanks